Okay, Satyam, you'll be telling me about all the uh, experience that you have after your studies.
Okay, sir.
You will be
So,
telling about your clinical experiences.
okay, sir. Sir, can I talk about my internship as well?
Yeah, yeah.
Okay. Sir, when I was doing my internship, during my internship, I was posted on the Department of Community Dentistry. So under it, used to have dental camps, used to go to villages to provide free health checkups and also various treatments like RCT, dental extraction, and minimal procedures, which doesn't require very invasive. And apart from it, we used to conduct street plays to tell people about the different risk factors of oral carcinoma. And if they have oral carcinoma, we used to advise them to come to the hospital for a checkup or for the treatment. And apart from that, I used to have free health screening drive where we'll be screening people for various kinds of oral carcinoma and oral infections. After finishing my internship, I worked in dental clinic in Odisha for more than 2 years under senior dentist. Under senior dentist, I learned about various dental procedures like uh, oral cleaning, RCTs, um, various other dental procedures like filling, even orthodontic treatments, and parental surgeries as well. And apart from that, I also learned about the patient management.
Okay. Can you tell me what challenges that you faced as an employee in the clinic?
So the biggest challenge as an employee while I was working was to handle the patient. I have dealt many difficult patients. Many times patients come and in the beginning phase of the treatment, they ask about how much money it will cost. And they agree to the treatment cost. And after treatment, they are like, sir, can you please reduce the cost of the treatment? So there is a difficult scenario. In that scenario, we cannot reduce the cost of treatment because it will cause loss to the clinical profit. So in that case, I had to communicate with the patient, tell that we have our own expenses, we have to pay this bills, and we also have to buy the dental materials, and we also have equipment costs, and we also have fees as doctors. So in this scenario, what the best thing I can do is that I can reduce the amount a little bit, maybe if the person has issues in paying the full amount, maybe by 200 or 300. But I tell that it is impossible to reduce more than that. That was one difficult case, and I used to encounter this quite often, quite frequently, where patients used to negotiate the money. The second problem was with the dental assistant. The dental assistant was not very skilled, and in my area where I was working in Sambalpur district of Odisha, finding a dental assistant who is very experienced, has clinical experience, and also to assist in dental surgeries or dental procedures was very difficult. So I had to train the dental assistant. I had to tell him frequently how to do the procedure and how to assist him. That was the second problem I faced. And third problem, the challenge I faced is that managing the dental profits along with patient satisfaction. This was one very challenging factor. Many times I've noticed that dental clinics are not able to make profit keeping the patient satisfaction in mind. Either the patients are satisfied or dental clinics are not making profit. One of them has. So managing both of these to have a sustainable clinical future was very challenging. One way I have noticed is that when the patient comes with different kinds of problems, different kind of oral problems, and patient is seeking only treatment to one of them, and after treatment is done, I made sure that I tell the patient about other dental problems that the patient might encounter. For example, the patient has a decay in his tooth or few of his teeth, and patient is only wanting RCT in one of those teeth. After the RCT can tell the patient that other teeth also require the sealing. If he doesn't do this sealing, the necessary
Okay,
sealing,
that's
he
fine,
might.
Satyam. I'll interrupt you. I would like to know the fee that you decide, or in a clinic when they decide the fee. So how they reach to the certain price point that this should be the fee for their services or charges. This should be charges for the clinic or the treatment, any treatment you provide.
Hello, sir. I couldn't understand your question. Your
I
voice
was
was breaking.
telling you, how do you decide or how your clinic decides that what fee should be charged to the patient for consulting as well as treatment?
So fees are actually decided on various factors. There are various factors to it. First of all, that if the patient is a regular patient, if he comes to visits to the clinic very often, if the patient is visiting very often, we can think of reducing some amount for the subsequent treatments. That is one factor. The second factor is the cost of treatment. How many dental materials are using, what kind of equipments have been used, and how long the dentist is working. So based on that, also we decide the cost. And the third factor is the severity of the disease and how long the treatment will go on. If the treatment is happening in subsequent phases, like 2, 3 sessions of treatment, definitely the cost will be high. So there are various aspects to it. So when we're deciding the cost of treatment.
Okay, so was it also, do you also think that the cost is also based on what other companies or other clinics are having that fee? So do you
Yes, so
match your
definitely.
cost with the market or you keep it independent from your own analysis?
So definitely in our area, there are 3 to 4 more dental clinics who are offering the same services. So it was a competitive market. So you have to keep in mind that while we are providing services and keeping a certain amount of cost for the services, we have to keep in mind about the other dental clinics as well who are providing the same service. So it was a competitive price, I would say. And also we have to keep in mind that we are not compromising our cost based on what other clinics are providing because we had our own treatment, I mean quality of treatment. Also we had our own cost. So it was not completely affected by the competitive prices provided by other clinics, but it was to a certain extent was affected. I would agree. Sir, I'm not able to hear you. You are muted.
Okay, Satyam, sorry, I got a call, so I had to disconnect. So okay, so the pricing part is okay. So now, can you tell me, what are the major departments that a hospital has?
Major department the hospital has, sir? Is
Mm.
that what?
So
Sir, the major departments are the first one is so there are 3 major departments. One is the clinical department, and the other one is non-clinical department, and the third one is the administrative department. Under clinical departments, we have various uh, clinical departments like we have department of medicine, we have department of surgery, we have department of pediatrics, department of obstetrics, and there are specialty and super specialty departments. And also the nursing department is also there in clinical department. In case of non-clinical department, we have housekeeping department, laundry department, we have technicians, we have engineers to manage the hospitals. And when it comes to administrative services, we have administrators who are managing the hospital, like floor managers. We have executive staff members. We also have hospital administrators.
okay. So while talking about hospitals, why the role of management? Why management is very important? Matlab, why administration, efficient administration is important for hospital?
So the most important point in the hospital administration is why it is so important is it brings everyone together to achieve a common goal. Hospital has its own goals and objectives to achieve, and they have a particular budget for the same, and they also have a deadline to achieve the same goals and objectives. So the idea of a hospital administrator to bring every department together to make sure that everything is running smoothly. So a hospital administrator make sure that the daily operations are going smoothly without any hindrance. So I think the role of a hospital administrator is very
Okay,
crucial.
let's leave the hospital for now. Let's go for the administration part. So why do you want to join this MPH Health Administration program?
So while I was working as a doctor, I have always noticed that the clinical, when it comes to clinical aspect of working in a hospital, we always focus on the curative aspect of the treatment. We always made sure the patient receives the care of the treatment and the service. We're never able to reach the preventive and the promotive aspect of healthcare. So that has always I have kept in mind. And while I was posted in the community dentistry department and working in the rural area, I got to know about different health issues of the rural masses. It made me curious about how healthcare programs are affecting the healthcare outcomes. And I got to know about this while I was working in a clinic. So if I pursue this course, health administration, it'll provide me, it'll give me knowledge about the organograms of different sectors of health, different sectors of health, and also I'll get to know about the staffing, budgeting, coordination conducted by each department of public health.
So you belong to Odisha, है ना?
Yes, sir.
So can you tell me the health infrastructure that state has?
Yes, sir. Definitely, I can. So the first thing is that we have a shortage of doctors. According to the state reports,
No,
we
I'm just
have.
talking about what are the infrastructural component of infrastructural details of your state's healthcare, how they have
Okay,
organized their primary healthcare centers and secondary healthcare centers
okay, okay,
and other health services that they are providing.
okay, sir. So when it come to healthcare structure of Odisha, so the first primary healthcare sector, we have sub-center and primary healthcare center. Then we have community healthcare center. Above that, we have sub-divisional hospitals. Then we have district hospitals. Here, there is a population norm for the sub-center. We have sub-centers in the plain area. We have one sub-center in 5,000 population. There's a population now. But in Odisha, we have sub-centers for around 6,800 population people. And also, when it comes to primary healthcare center, the primary healthcare center is there in the plain area, talking about the rural area. According to the population norms by Indian health public health standards, the primary healthcare center should be there in a population of 5,000, and hilly and difficult area should be in a population, sorry, in a population 30,000, and hilly and difficult area should be in a population of 20,000. When it comes to community healthcare center, it should be there in a population of 1,20,000, and in case of hilly and difficult area, it should be in a population of 80,000. So in Odisha, when it comes to rural healthcare structure, these population norms are not strictly followed. We have primary healthcare center which are catering even more than 20,000 or 30,000 population in plain area. And same goes for the community healthcare centers. So when it comes to, sir, can I talk about the bed and population ratio as well?
Haha. Just include everything that you find important.
So according to 15th Finance Commission reports, India has a bed population ratio of 1.4 beds per thousand population, which is less than WHO standard of 3 beds per thousand population. But in Odisha, we have even less. We have zero point 0.4 beds in thousand population. So there is definitely a shortage of beds when it comes to infrastructure. Then there is shortage of workforce, and so that's all I can think.
Okay. So despite all these attempts, still a lot many of our population is underserved in terms of health services. So what reason do you find for this?
So the first problem I would say that even though there are so many policies, even though there are so many schemes by state government, for example, the NMI scheme is there to provide free medicines. The NMI scheme is there to improve the ambience of the hospital to make it more hygienic for the patient. Nidan scheme is there to provide free diagnostics. Even though there are so many schemes, I think they are not able to effectively implement and monitor the schemes. And people in the rural area are not able to get the benefits of the scheme. Even though they are able to get benefits of the scheme, it's not penetrating the scheme. Penetration scheme is still low. Orissa has more than 62 tribal groups, and there are 13 groups of particularly vulnerable tribal groups. So the penetration of scheme in this tribal area is particularly very less, and they face a lot of health issues. And one major problem that they face is access to healthcare. They stay in the hilly area, so coming to the public healthcare centers, sub-centers, which is situated in the plain area, is very difficult for them. So the first problem the people are facing is accessibility, and the second problem is affordability. If we look at a National Family Health Survey report and look at the out-of-pocket expenditure in the public health care for the delivery, it is more than 4,200 rupees for Odisha. When see at my district, the out-of-pocket expenditure is more than 4,800 rupees, even more than, which is more than when states out-of-pocket expenditure per delivery in public healthcare centers. And the third problem is the lack of ambulance service. In sub-divisional hospital, there should be more than three ambulances. In my area, there is sub-divisional hospital. There is only one ambulance. and that ambulance only used for critical service, providing critical healthcare services and transporting patients from their home to the hospital. There is no services to take patients from hospital to their homes after the delivery or after a critical operation procedure. And the
Okay,
fourth problem is
okay,
that,
okay. So now I'll shift the question. So can you tell me what are the major disease that your state PM matlab is concerned about, or what are the major disease from which people are suffering from illness, prolonged illness, or death?
so according to the report of Global Burden of Disease, Odisha has a very high incidence and prevalence of malaria. We all know it.
Very
There
high
are
incidence of
malaria,
malaria.
high incidence and prevalence of malaria. But yeah, to counteract this, Odisha has come up with a scheme. It's called Durgam Anchala Nirakaran Initiative. Under it, ASHA workers have been distributing nets, mosquito nets to individuals, and in the southern districts of Odisha, around 8 districts. And we have seen 70% reduction in malaria cases as well in those districts. But apart from that, in other districts, malaria is still present. The second problem that we face is malnutrition. Malnutrition is very prevalent among children in Odisha. And yes, and there is also diarrheal diseases. It's because of the poor sanitation and also lack of hygiene. And also the open defecation is very prevalent in Odisha, in many other districts and rural areas.
Okay.
Because
So
of
what is
that,
the child mortality rate of your state?
so the infant mortality rate, according to sample registration system 2018, is 32, sorry, 40, when the national average is 32. So it is more than national average.
So what is the
And
reason behind it? Matlab, what reason do you find?
so the first reason behind the infant mortality rate is asphyxia. When the birth is happening, the baby is not able to breathe due to birth complications. That can result in death of the baby just after being born. And the other problem is the health of the mother. Many of the mothers are anemic and they lose a lot of blood during the parturition. So that can lead to death of the baby. And if you say the under five mortality, I think the biggest killer would be malnutrition and also diarrheal diseases. Also, one biggest problem in case of infant mortality is pneumonia. So these are few problems that is actually driving the high infant mortality.
So what suggestion do you, what intervention do you think that government should create in terms of policy to
So,
maintain a very low infant mortality?
so the government has taken many steps. If we see Swachh Bharat mission, under it more than 10 crores toilets have been constructed, and it has also an impact in Odisha.
Suggest something from your side,
Yes,
which government is not doing right now, but you can suggest that this can be one of the
yes.
solution or one of the steps that government can take.
Definitely, in my opinion, building toilets is not enough. If many people are not using Odisha. In my own experience, I've seen toilets have been constructed different ways. So I think an awareness is needed to change the behavior of people towards the sanitation and the cleanliness of the environment. This will also decrease the prevalence of diarrheal disease. This is one thing. The second thing is that they're reducing the out-of-pocket expenditure. So there is a lack of awareness about the government scheme. There are many schemes for poor people in the area. They do not know about the schemes. So there is also a need of increasing awareness about different schemes. It needs to penetrate the rural mass. People need to know about the water schemes are provided for different different reasons. So the second thing I would say that the penetration of schemes should be more, even though there are schemes, the penetration should be more. And the third is that improving the nutritional status of the children. This is done through various initiatives like Mission Poshan Abhiyan, and under Anganwadi Center, free midday meal has been provided, and also ration has been provided to children to take to their home.
Okay.
And their need of more Anganwadi centers in
Okay,
the rural
chalo,
area.
thank you. तो मार्क्स पे तुम्हारा आई गिव यू 75 -2 23 -1 -2 71 प्लस में रहेगा तुम्हारा नंबर, ठीक है, ये ठीक है, मतलब मैंने थोड़ा कंजर्वेटिव दिया है, ठीक है। सो सजेशन में मेरा ये है कि मतलब सजेशन ऐसा कुछ नहीं है, मतलब तुम बहुत इम्प्रूव करना, थोड़ा और डेटा वेटा ही ले लो, ठीक है। जो अपना स्टेट रिलेटेड, नेशनल उसमें रिलेटेड, एक्चुअली हुआ क्या कि हाफ ऑफ द टाइम हम ही 10 मिनट पहले 5 मिनट ना, आई वाज थिंकिंग ये हॉस्पिटल एडमिनिस्ट्रेशन का इंटरव्यू है। सो ऑल ऑफ सडन आई रिमेम्बर्ड कि नहीं, ये हेल्थ एडमिनिस्ट्रेशन वाला है, तुमने बोला था मुझे, समझ आ रही है बात?
तो
तो
इसका मिक्स हो गया, मैं कंफ्यूज हो गया था बीच में कि
तुम भी कंफ्यूज हो गए थे ना, सर क्या चाह रहे हैं। तो ये बड़ा
मेरी
दिक्कत हुआ, बट मतलब मुझे लगा कि चलो ठीक है, ऐसे हेल्थ में तो सारी चीजें जरूरी है पूछना, और वो भी पूछना एक इम्पोर्टेंट चीज है, आखिर हेल्थ एडमिनिस्ट्रेशन में भी तो हॉस्पिटल की बात होती ही है ना। तो इट वाज गुड, ऐसा कुछ दिक्कत नहीं था, सब तुम्हारा सही था। मैंने थोड़ा कंजर्वेटिव होके मार्क्स दिया है ना। तो 71 तो ऐसे मैंने लिखा है, बट यू कैन एक्सपेक्ट 74 75 ऑल्सो।
सर मैं अपना पूरा आज थोड़ा कल रात भर में सो नहीं पाया, पहली बात तो यहाँ पे पास।
हाँ, वो थोड़ा लग भी रहा है तुम, और आवाज आवाज भी थोड़ा ना सही रखो, और लाइट का कनेक्शन तुमको बोलते हैं सही करो, पीछे लाइट की बजाय आगे लाइट रखो।
वो तो मैं आगे चला हूँ, तो ठीक है।
हम्म।
तो शायद मेरा इंटरव्यू बेटर होगा सर, मेरा जो स्पीच
हाँ
है
हाँ,
जो एनर्जी है।
बैकग्राउंड एक या तो ब्लैंक फोटो बना के ना पीछे डाल लो
और सर वॉइस
जूम में
पूरी
ना।
डाले।
हाँ, और लाइट सामने से रखो तो और अच्छा, जितना कंजीनियल इन्वायरमेंट क्रिएट करोगे ना, उतना बेटर तुम्हारा इंटरव्यू होगा।
सर उसके लिए मार्क्स है क्या?
नहीं नहीं, उसके लिए
हाँ
मार्क्स नहीं है, उसमें क्या होता है ना कि इंटरव्यूअर को अच्छा लगता है,
हाँ
मतलब तुम्हारी तरफ देखने में, स्क्रीन देखने में, है ना। अब स्क्रीन देखने का मन नहीं करेगा तो तुम सोच रहे हो, आदमी बोलेगा जल्दी जल्दी इंटरव्यू लो इसका। तो
हम्म,
मार्क्स, वो उसमें मार्क्स नहीं होता, बट वो है ह्यूमन फैक्टर है, कि
हम्म,
जितना तुम अच्छा इन्वायरमेंट दोगे, सामने वाला उतनी देर तक रुकेगा।
हाँ सर,
ठीक है।
मैं कोशिश करूंगा सर डेफिनेटली इंप्रूव करने के लिए 80 से ऊपर।
हाँ, बाकी बढ़िया इम्प्रूव्ड है यार, तुम अच्छा इंटरव्यू दियो, क्या बात कर।
सर मैं
ठीक है,
कोशिश तो करता हूँ सर, और ये मेरा
ठीक
सेकंड प्रेफरेंस है सर। और थोड़ा
ठीक
मुझे
है।
लगता है कि कहीं ना कहीं पढ़ाई थोड़ा कम है, थोड़ा और भी रिवीजन कर रहा हूँ, 2 दिन तो बाकी है, फिर भी 48
हाँ,
आवर्स।
थोड़ा सा हेल्थ इंफ्रास्ट्रक्चर ही थोड़ा और पढ़ो, है ना, चैलेंजेस पढ़ो, हेल्थ इंफ्रास्ट्रक्चर पढ़ो, व्हाट वी आर गोइंग टू ट्राइंग टू अचीव, ये पढ़ो। स्टेट गवर्नमेंट के थोड़े इनिशिएटिव पढ़ो, सेंट्रल गवर्नमेंट के इनिशिएटिव्स पढ़ो।
और थोड़ा
आगे
क्लैरिटी भी चाहिए स्पीच
हाँ,
में।
न्यू हेल्थ पॉलिसी में क्या है वो सब पढ़ो थोड़ा। ठीक है, चलो,
ठीक है।
ओके।